Today I wanted to start off by talking about the LPN programs, or Licensed Practical Nurse programs. And even though they sound similar, if you compare an RN with an LPN, their career and education, you see that they have fairly little in common in terms of job tasks, educational paths, and salary ranges. LPNs usually provide more basic nursing care and are responsible for the comfort of the patient. RNs, on the other hand, primarily administer the medication treatments and offer educational advice to patients and the public. So I'm just going to go through and show you a little bit about what the LPN program does and what LPNs can do, so it's easier to understand the education behind it. So in this portion of the spreadsheet here, you can see what an LPN program is. Those programs are generally about a year. They take about a year or 3 15-week semesters. Upon graduation, those LPNs are able to contribute and be a part of the healthcare team. They are a part of the profession. They provide patient-centered care, such as bathing patients or infants, feeding infants. They can be assistants with medical equipment, with assembling or cleaning. They can start kind of routine medications like IV fluids, but never blood products or chemotherapy. And they have the ability to monitor medications and take vital signs and things of that nature. When talking to an LPN program, their general concerns can be that the assignments may be too in-depth or too detailed for this level of nursing. So to kind of counter that, you can emphasize the interview guide, because that is a really nice way for their students to be able to get the benefit of all of the learning, but to have that guidance with it. And then also you can emphasize the in-depth quality of the assessment skills the students are going to learn to prepare them if they want to go on and become RNs in the future. So some nice talking points there. This is commonly required, a list of the commonly required courses for an LPN program. I'm sorry, that should say LPN. There we go. And we have all of the kind of routine core necessary courses if you're going to be working in the medical field. And there are a few really nice fits. They have a dosage calculations course because they do have some medication administration, like some simple IVs. So our pharmacology product would fit nicely there. Generally, they do also have a gerontology course. Again, they have that pharmacology course. Administering those simple medications, they could maybe use the basic and intermediate. I'm not sure that they would ever venture into the unguided case or the more complex case, but they would be able to use pharmacology in both of these two courses. We also have a health assessment in the acute care nursing, and they could use the focused exam DANI in their pediatrics course. There are also kind of tier 2 courses. We have medical surgical nursing, which it could fit if they need to use it in more than one course. This course focuses on caring for clients with musculoskeletal issues, mental illness, digestive disorders, urinary alterations, and cancer in settings across the lifespan. So our gero patients and our mental health patients really hit quite a few of those different topics that they're going to be utilizing. And finally, if you have someone that is going to utilize the health assessment product, you can go ahead and encourage them to even use the concept labs in their anatomy and physiology class if they think that that might be a fit for them. Those concept labs are a really nice way for the students to be able to really visualize and become familiar with that anatomy. So that is the LPN program and the courses related to it in a nutshell.